Hospitals by Professor Tammy.
Hospitals, Part 3. Licensure, certification, and accreditation. Licensure is required to order to operate a hospital. So you need a license to operate a hospital. State governments, state departments of health oversees their own set of standards. So they emphasize on physical plant compliance, that the physical building, like building codes, fire safety, climate control, space allocation, and sanitation. You also need a certification. It allows a hospital to participate in Medicare and Medicaid. And compliance with federal conditions of participation is necessary. Accreditation. The Joint Commission accredits a variety of healthcare facilities, a private nonprofit organization. Accreditation confers deemed status on hospitals. Hospital organization. A hospital is generally responsible to stakeholders. Stakeholders are those who are affected. The stakeholders would be the community, the government, the insurers, the managed care organizations, and the accreditation agencies. Internally, hospital governance involves three major sources of power. The Board of Trustees, which is the governing body, like the Board of Directors. The CEO, who receives delegated authority for the board and is responsible for managing the organization with the help of senior executives and the medical staff. Ethics and public trust. Most significant ethic issues occur in acute care hospitals, where they deal with the very sick. Factors are advanced technology and constraints on reimbursements. Ethical challenges are physicians and caregivers are guided by the principles of beneficence. They alleviate suffering, and the non-maleficence of moral obligation to harm patients. The difference of opinion on what constitutes an extraordinary or heroic measure to sustain a person's life. Addressing ethical issues. Ethics committees are charged with developing guidelines and standards for ethical decision-making in the provision of health care. Interdisciplinary involving physicians, nurses, clergy, social workers, legal experts, ethics, and administrators. The Patient Self-Determination Act of 1990 applies to all health care facilities participating in Medicare and Medicaid. The law requires health care facilities to provide all patients on admission with information on patients' rights. Informed consent is a basic patient right. They need to know. The right to make an informed choice regarding medical treatment, including the right to refuse treatment. Advance directives is a patient's wishes regarding continuation or withdrawal of treatment when patient lacks decision-making capacity. So when the patient can't decide, it's usually someone else that decides for the patient. Public trust. Hospital administrators have a fiduciary responsibility for acting prudently and managing the organization. The hospital should be viewed as a community asset. When such a viewpoint is lost, a breach of public trust can occur. Conclusion. Any facility that treats patients on the basis of an overnight stay is called an inpatient facility. The most common types of inpatient facilities are hospitals and nursing homes. Both trace their beginnings to almshouses and pest houses. Both expansions and contraction of hospitals are triggered mainly by government policy. Severe restrictions on the expansion of physician-owned hospitals. The majority of hospitals in the U.S. are community hospitals.
See you soon, and remember to read the book.